Okay, everyone, we have a really fun special episode for our last episode of season 6. So, for those of you who don't know, my little sister Alli, my best friend, but also she is a nurse as well. I thought it would be really fun for her to come on and we could do a little bit of aesthetic chat, but more talking today about nursing careers and picking more of a soft nursing as a specialty. And I know that she's a little bit nervous, but we're really excited to have her. Also, she is jumping into YouTube and doing more long form content, and she's really enjoying that. So I'm excited to hear kind of what she has to share with you all. Obviously, I know her story, but I'm excited for you guys to get to know her a little bit more. So welcome Alli Gamble to the pod.
Hi, everyone. Yeah, my name is Alli, and I'm so excited to be on my very first podcast ever. Definitely a little bit nervous, but I think that doing YouTube for a little bit has helped with kind of being camera shy. So I'm excited to be here, and I can't wait to let you guys in on kind of my journey of being a nurse and going into the soft nursing life.
First, introduce yourself, how you ended up in nursing, and where you're working today.
I graduated with my BSN in 2022, and I ended up getting a job in the NICU right out of postgrad. So I was there for a year. And then after that, I transitioned to a few different outpatient positions, and I'm currently in allergy, asthma, and immunology. And before becoming a nurse, I was actually a CNA. So I worked in long-term care facility. I worked in assisted living. I feel like that really gave me a good sense of patient care and taught me about my purpose in nursing. And so I feel like it was a really good stepping stone into the nursing field.
I think you also forgot to mention she did work as a CNA in the hospital as well.
I did. It was orthopedic trauma. And so I feel like that was my first time really stepping into the hospital setting as a CNA. And it's different than assisted living and long term care. A lot of the patients were more critical. And so they just have a lot more emotionally going on. I feel like it was a really good learning experience. So I think for me, it was really important to be very attentive, very kind and compassionate. And I feel like it just really taught me to transition that into my nursing career as well.
Yeah, I think what's also very interesting, we both are nurses, but if you actually look at our resumes or if you talk to us about our different nursing experiences, they're completely different. Just because we both went to nursing school does not mean that we know the same things or we like the same things or we do the same things. And that's been very evident, obviously, in our paths as nurses. But I think something important to mention too for those listening, if they're not a nurse yet or they are interested in nursing and they're just like, I don't know if I could do some of the things that nurses do. I think it's a comforting thing, and I want you to speak more on this, Alli. When you were little, you used to get like nauseous and like physically ill about being just even in a hospital. I remember when our grandparents got sick and we were there for an emergency and you just were not handling it well. And so
Yeah.
seeing you as a grown up now and you have done again, all sorts of nursing. You have been a CNA in multiple different settings. I don't want to say that you don't have a strong stomach, but I don't think anyone in our family would have guessed that you would have
Yeah.
become a nurse and have been so great at it. So,
Mhm.
how did you get through that? And I mean, is that still something that affects you today, or are you now just like, it's whatever?
Yeah, it's actually crazy to think back on just your journey. I was younger, I hated the hospital. When we were in the hospital in the waiting area, I remember I was just laying down and had a trash can right there because I just felt so nauseous and sick to my stomach from, I think it's maybe movies that just portray hospitals a little bit scary. And so I think just growing up and seeing that. But I volunteered at the University of Washington Med Center. And so from kind of a young adult age, I kind of just forced myself into the setting. And I think that's what you have to do a lot in life, I've realized, is you just, no matter how uncomfortable you are, you just got to push yourself and push yourself out of the comfort zone. A lot of good growth can happen when you aren't comfortable. And so I feel like it's amazing and fun to look back on how far I have come just from being so afraid of the hospital, so afraid of kind of like blood and anything scary. And now it's still a little bit intense to see, but I think I've just kind of understood a lot more of the background of nursing and everything going on.
So would you say if someone is listening and they're like, I don't know if I can do that. I'm that person that gets nauseous and is anxious about those things. Is your advice to try it anyways. Start maybe in a volunteer role. You're not touching anything. You're directing people around or you're pushing people in a wheelchair, but
Yeah.
you're not doing anything directly with the patient. Do you think that's a good starting point and then getting into something like medical assisting or a CNA
Mhm.
to kind of get your toes wet first?
Yeah, I think that's a good idea. I think if you really gravitate towards nursing and towards a nursing career, it's always a good step just to get your foot in the door. And even if it is, like Kiana mentioned, doing like medical assistant, CNA, anything like that, or even just volunteering, I think it's a good way just to be around the environment and be around patients and just kind of start your journey of patient care. It's always great just to make little baby steps to get where you want to be, because I know for me, if you look too far in advance, it can be really daunting and scary. And so I always try to take things kind of baby steps at a time, because I think those baby steps are going to compound into your ultimate goal that you would like.
Great advice, Allie. You said that you did work in the NICU starting out as a
Hmm.
new grad. And I mean, that's a pretty amazing accomplishment. If you're not specifically within the nursing world, it's pretty rare to actually get an offer into the NICU as a new grad. I don't think that should be glazed over because I think that says a lot about, again, your work ethic, your abilities as a nurse, and just you as a person being able to, take that on. Talk to me a little bit about the experience working with the babies, but also just
Hmm.
talk about um, that transition to night shift and working 12 and a half hour shifts and kind of what pushed you towards going outpatient.
Hmm. Yeah, so I actually did my practicum, my S2 semester in the NICU. And I think that really helped me get a job post grad in the NICU. I was there for a year. I was on night shift the entire year that I was there. And I actually surprisingly think that the NICU is a really good place for new grads to start. I know it's a critical care setting, and so a lot of people maybe don't think that new grads should start there. But I found that the hospital that I worked in, they really eased you in. And so the first year you strictly did feeder grower babies, you did CPAP babies, and at your 1 year, then you were trained to more of vented babies and just a little bit more critical. And so I feel like it was nice because they really eased you in and didn't just throw you in head first, because I know a lot of new nurses, they feel really overwhelmed because they're just kind of thrown out there. And so I feel like it was a good setting, especially being with neonates. They are so protective of their babies. And so it's just nice that everybody's a team in the NICU and everybody has one goal of being there for the patient and doing what's best for the patient. And so I think it's really special because you do have that kind of camaraderie on the unit. And the babies are critical. And so you just want to do your best to take care of them and get them better and healthy. I think just having that common goal is really great for a new grad, and just having that support as well. There was a lot of older nurses who have been there for 10 plus years, and they're so willing to help you and teach you and just pass down all of their wisdom. And then transitioning outpatient. So at my 1 year, I was a little bit nervous about being trained on vented babies. I was having a really hard time with night shift as well. And so just kind of doing some reflection and just really kind of thinking what I wanted to see my future be. I decided to look at more outpatient positions, and I ended up getting a job in an ambulatory surgery center, pre-op and PACU. And that transition was interesting because I was so used to working with neonates, and then having to transition to work mostly with the adult population, I think was kind of a big shift, even though I had experience as a CNA. I just think in your nursing role, it's so different. And I think that the transition is definitely doable if you are wanting to go outpatient or go from peds to adults. But I think it's definitely a learning curve for sure.
hmm Well, I think too, your transition probably was a little bit more tough just because the specific role you did have right after you had started, the company got bought out and then there was merging and there were layoffs. And I think there were so
Yeah.
many other components that we don't think about, when you think of your job as a nurse.
Hmm.
Those outlying factors that are outside of your control when it comes to a business
Hmm.
have a pretty significant impact on the treatment that you're able to give to your patients and the care that you're able to give them. And specifically in that setting for you, and you can talk about this a little bit if you'd like, I
Hmm.
think you did struggle because of those outlying factors, you didn't feel super confident in your new role because you didn't have a lot of
Mhm.
training. But
Yeah, so when I got hired for the outpatient role, I feel like I was a little bit deceived. And so I think if you are transitioning to outpatient, really be careful about the questions that you ask in your interview because there was a lot of management change going on and more of, I guess, at the system level versus just your role as a nurse was going on. And so there was a lot of short staffing, a lot of staff members had left, and they were hiring in majority of travelers. And so it was mostly travelers, a few new hires, and then maybe 3 or 4 nurses who have been there for many years. And so I think just that transition was also really hard. They didn't have the staffing to give you proper training. So pre-op, I felt super comfortable. I felt super confident in that. PACU, I felt confident with the phase 2 patients. But the phase 1 patients, I didn't actually end up taking care of them unless I was partnered with another nurse. And so it was just hard because when a patient would come out, they would come out phase 1. I just felt like I almost was a burden because I couldn't take on this patient by myself. I had to have another nurse with me. And being run short staff, you want to be able to step in there. But again, if you don't have the training, it's going to be safer to be with another nurse. And so I think that's one thing that I really try to take from the experience is that it pushed me to advocate for myself. And Kiana knows this, but I am pretty quiet and I try to speak my mind a little bit more and I tried to advocate for myself more. And so I feel like that position really forced me to just take charge of myself and take charge of my nursing license, honestly, because a lot of people will tell you to protect your license. And so I think it's just really important if you don't feel comfortable in a situation, it's really important that you speak up. And so even though it wasn't maybe the most ideal position for me, I do think that there was a lot of learning and growth that came from it that I will take on for future jobs as well.
so tell everyone after you transitioned from this role, where did you go to your next job?
So I actually ended up getting a job in dermatology, and specifically it's called Mohs surgery. And so you assist your surgeon in skin cancer removal. And this was probably one of the most interesting jobs that I've had. I feel like it was so cool to see the surgeon find the skin cancer and cut it out and then repair it. And so there was a lot of different sites that you would see, different sizes, different repairs. And I think that's what's so special about nursing is you can try so many different specialties, and Mohs surgery is something that's so niche that even when I was applying, I had no idea what it was. I just knew it was dermatology and I had never heard of it. And so it's just amazing that there's so many different specialties and different niches that you can go into as a nurse. I did that job for about a year and a half and I really liked it. I think it was still exhausting and tiring because you're on your feet the whole entire shift. But I think time passed so quick because you were constantly turning over the rooms, you were doing HPIs, rooming patients, and then you were setting them up for surgery, assisting with the surgery, helping with the repair, and doing wound care. You were going over discharge instructions. So there was just a lot of components that kind of kept your day moving, which I think was really fun.
Nice. And I think it probably helped that you had an amazing surgeon to work with. But for somebody that's like, oh, Mohs sounds really cool. I would love to get into that or derm or an opportunity like that in nursing. Do you have any advice for them? Because I know that getting a job in derm is very challenging as a nurse.
Yeah, I think if you're interested in it, definitely even just shadow. I think it's a good idea to just try to reach out to a clinic and see if they're willing for you to get in there and just kind of see what Mohs surgery or even dermatology is all about. I know sometimes getting into specialties can be really hard, but I think that once you find that one clinic that's gonna give you the opportunity, I mean, you could go anywhere with it because now that I have that experience in dermatology, if I ever wanted to go back, it helps having that experience. But I think you just have to stick it out. If that's what you really want to do, just keep putting yourself out there, keep trying because at one point you're gonna find somebody who sees something in you and sees that you would be a really good nurse to work in dermatology. And so I think just being persistent and if you have your mind set to it, just keep going at it.
Great advice. So then tell everyone why you left the dermatology Mohs job, because I mean, honestly, it sounded interesting. It sounded like you had a
Mhm.
great kind of team that you worked with. You had great hours too. You didn't have to work
Mhm.
weekends,
Yeah.
holidays. I think that's another huge thing about what we call like soft nursing or
Mhm.
outpatient nursing is those components. But tell everyone kind of why you ended up leaving that role and then how you
Mhm.
ended up finding the job you have now.
Yeah. It definitely was a very ideal job. I worked 4 days a week, no holidays, no weekends. I actually ended up wanting to move down to Arizona. And so I got a job in the allergy, asthma, and immunology clinic that I currently work in. And I just found this job on Indeed. I had been looking probably for a few months and just kind of browsing what was out there and keeping my eye on everything. I ended up seeing this one posted, and I knew I wanted to stay in the clinic setting and the outpatient setting. And so I ended up applying. I got an interview, and I loved the two girls that I had interviewed with. One of them was the partner, and the other one was the nurse manager. And I just felt their warmth and their compassion. And the interview, even though I was nervous, I just felt really comfortable still. And so I knew that it was a good fit. And they ended up offering me a job. And so that's why I left the Mohs dermatology job. If I wouldn't have moved to Arizona, though, I definitely would have stayed longer because it was such an interesting job and the conditions were ideal, minus the short staffing. But I think that's just a healthcare kind of problem that they're having is short staffing. I think you're going to find that anywhere. But other than that, it was ideal.
So you mentioned earlier that once you kind of get a job in dermatology, that opens so many doors. And you were actually interviewing with a Mohs clinic in Arizona as well.
Mm-hmm.
You had just said that you wanted to try something else, but again, those doors kind of swing wide open. I think right when they saw you have that training in Mohs, you already know kind of what to do and how to do things. They were
Mm-hmm.
like, oh, we need to hire her. So they were kind of,
Mm-hmm.
I wouldn't say like pining for you, but they were definitely following up a lot. Like, "Hey, are
Mm-hmm.
you still interested in the job?" I think it probably came down to, pay or hours or something, more logistics wise, but I think you have opened a lot of doors for yourself by trying a lot of different things.
Mm-hmm. I think with Mohs surgery, especially since I had that on my resume, when they saw it, it is again such a niche thing that they um, liked that I had that experience. But yeah, it was more logistically. I think with the drive and everything, it would have been maybe like an hour drive to work. And so I ended up going
Yeah.
with the allergy, asthma, immunology clinic. It was an hour drive.
An
It was
hour
far.
drive is a long time. Yeah,
Yeah.
no, I was
Yeah.
saying no. Like, I think most people would have been like, no, an hour is too far. Like, I used to drive
Yeah.
45 minutes to an hour one way. And I think it's fine for a while
Hmm.
until it's like one of those things where it's not fine. I think anyone can relate to this where you can withstand certain conditions for a certain amount of time. Every person has a different like threshold for bullshit. But once you hit that meter and you're like, okay, I'm done,
Yeah.
that's when it's the right time to say, love the opportunities that I got or what I learned from
Hmm.
this, but I'm ready to move on now.
Yeah.
Actually, I have a few questions for you based on kind of your responses already. And my first question for you is actually going to be, obviously, you had hospital experience. Now you've
Hmm.
had a plethora of outpatient experiences. What is your thoughts on new grad nurses going straight into outpatient setting? I kind of hate that we're calling it soft nursing, but that's kind of how it's seen for other people still inpatient
Hmm.
or other specialties. And so what are your thoughts on that? Do you feel like people need to graduate and start in the hospital, or do you think that
Hmm.
people would be able to kind of move right into outpatient and be fine?
I think people could definitely move to outpatient and be fine. I actually really love that there's a change in kind of the thought process of new grads being able to go outpatient right away, just because there are so many different specialties in nursing and so many different skills. And I think nursing school gives you such a good basis of problem solving, critical thinking, but after having a handful of jobs, I think that a lot of your training and a lot of your learning is going to be on the job training. I think that once you get into a specific role, they're going to teach you exactly what you need to know to be successful in that role. I don't think it's crucial to go bedside right away. I think that there are so many different opportunities. And if you don't gravitate towards the hospital and bedside, I think that it's totally okay. I don't think there's one path that you have to do. And I know that me and Kiana have kind of touched on it a little bit, but we have such different paths going into nursing, being a nurse. And so I just think it's something that's special about the career is that you can determine your own path and you can decide what you want to do. You don't have to follow the status quo of, I have to go bedside and get that experience for a year. It's totally okay to not do that.
I think where that
Mhm.
mindset comes from, you always hear if you went straight to outpatient, you wouldn't know the struggle of inpatient, right? When you're on those different units, it's rough. Like, especially
Yeah.
if you're like a med surg nurse, it's
Mhm.
really rough. And so I think that's where that sentiment comes from is like, you need
Mhm.
to struggle in the hospital to understand what it's like to do that hard nursing or real
Mhm.
nursing to then be like able to graduate into the soft nursing or earn that soft nursing and be able to say, wow, isn't this so much better?
Mhm.
Like, do you think that's where that comes from?
Maybe. I think it could potentially. I don't feel like that's the way of thinking now. I think that it's totally okay not to go bedside. And I get what you're saying of kind of graduate and earn your position into soft nursing and outpatient. But to be honest, I love outpatient and I don't think that somebody should be miserable for a year or 2 years in inpatient just to go to an outpatient position because a lot of the outpatient positions that I have had, again, they teach you exactly what you need to know. I didn't learn what I do now in nursing school. I didn't learn it in the NICU. I just think it's the critical thinking, problem solving, because a lot of nursing, even outpatient, you're going to problem solve a lot. You can't just go to the doctor right away. You have to stop and think through things. I just think that if you have those skills and you are strong in them, that you'll succeed in outpatient.
Yeah, I agree with you. I would like to clarify that I think it's okay to go straight to outpatient. I like that the landscape is changing too. Again, we both are out of nursing school now for many years,
Hmm.
but even going back and going into my doctoral program, I think that the same kind of sentiment was start in primary care, get that
Hmm.
foundation, and then you can specialize, or very similar to in nursing school where the big push is to start in inpatient.
I think that that mindset definitely could have come just from past ways because I know that back probably even before we graduated, that was the norm is you had to go bedside before you went outpatient. And so I think just over the years there has been a shift and I'm not sure what the change was, but I feel like that was probably old ways of thinking of if you go outpatient, you have to have that experience or they're not going to hire you. And so now that there's other people in those management roles who are hiring, I think that that really gives new nurses kind of leverage of if I want to go outpatient right away, then I do have the opportunity now.
So I actually have another question that came up. I think the only commonality within our nursing careers is we both were CNAs. We both know what
Hmm.
it's like to be at the very bottom of the medical hierarchy and being at the very bottom and not being treated the greatest, being the person that receives the least amount of pay, but doing the most amount of work sometimes. And I personally feel like being a CNA first before I was a nurse developed a lot of my skills because by the time I was a nurse, I was super confident in being able to care for the patient and interact with patients to where, like you're talking about, when I jumped into the nursing part of it, I could really focus more on the critical thinking and those types of skills versus trying to also feel confident transferring a patient. Do you feel like it's pretty crucial, or if most people could, they should go and get that CNA and get that experience first?
I do think so. I never was a medical assistant, so I don't know if that would be beneficial too. I'm sure it would be. But speaking on CNA specifically, I do think it's actually really beneficial. And I think that a lot of the nurses who were CNAs, I think it just gives you a really good foundation of, what it's like to, be at the bottom. You are doing anything and everything that you can and you're just kind of run thin. And so I think it's important as a nurse because you have that perspective of, you want to help out your CNA when you're in the hospital because as a nurse, I'm not sure how it was for you and your unit, but I think that you guys have CNAs on your floor that help the nurses out. Is that how it was
Yeah, but
structured?
the ratios aren't great. So, I would say at the end of the day, nurses wear so many different hats, and that I was
Hmm.
doing a lot of CNA stuff still. You can't escape it because of this short
Yeah.
staffing, like we talked about.
Hmm. Yeah, I think CNA, it just gives you that foundation of respect to, yes, you're the nurse and you're quote, quote, above the CNA, but I think it still gives you that mindset of it's my coworker and I need to be respectful. Yes, I want their help, but do it in a nice and respectful way. Or if they need help transferring because it's a two-person transfer and there's only one of them, go help them. Don't just tell them to figure it out. And so I think it just maybe gives a little bit more compassion to their role and kind of make it more of like a team effort versus a this is your job, go do this kind of thing.
Yeah, 100%. I think that you're totally right in the fact that you think more from a team perspective and you can have that perspective of what they're going through and being stretched really thin. And yeah, I think you can tell, again, maybe not in the outpatient setting, and you can correct me if I'm wrong, but in the inpatient setting, you can definitely tell the nurses that were CNAs first versus the ones who maybe weren't.
Hmm. Yeah.
So, because you've had multiple experiences outpatient, and I think that more and more nurses are looking for outpatient roles, you mentioned earlier how you kind of have to ask some of the correct questions. So, what kind of questions do you recommend nurses ask as they're making that transition and trying to find that next job that may be outpatient and they're used to inpatient?
Hmm. I think asking about patient ratio, so how many nurses are on, how many patients can you expect? And I think knowing the workflow of the clinic, and so kind of ask about, okay, what does a typical day look like? And how many nurses can I expect to be working with? I think also if there's a lot of management changes going on, really focus in on that. I had asked one of my last jobs, was this change good? How are people feeling about this? And just getting their perspective on, I think is important. And I know that it's a business, and so they're going to put their best foot forward. And I think that's kind of where I got deceived, but really focus in on what they're saying. Take what they say and ask follow up questions, ask more questions. Because now looking back, I wish that I wouldn't have just taken what she said at face value. I wish I would have kind of poked a little more and asked more follow up questions to try to dig deeper. Because again, they are going to want to make everything look shiny and good because it's a business. And so just really don't be afraid to ask questions, interviewing them as much as they are interviewing you. And that's something that I've tried to take into all of my different interviews because I think it just kind of eases the pressure of this is all on me and kind of focuses it more on it's a mutual decision. Am I going to be a good fit in the clinic? And yeah, vice versa.
I know that you have asked multiple clinics and you've actually done multiple days of this. Do you recommend that people do like a shadow day?
Hmm. I definitely do. One of my coworkers actually now, she is applying for other jobs and I had said, "Oh yeah, you should ask to shadow." And she had asked and I guess the clinic had never heard of shadowing. And so I think it's just a great thing. It shows that you're interested. It shows that you're taking the decision seriously and it's not like you're just going to throw yourself in and then say you hate it and you leave a month later. I think it just shows that you're being careful about your decision. And I mean, it doesn't hurt to ask. The worst they can say is no. And I think that's another motto that I've kind of taken into my life now and my work life is it doesn't hurt to ask because they don't know what you're thinking. And so if you just ask to shadow, it doesn't hurt and just see if you like what it is because every specialty is different. Every workflow is going to be different. And I think it's good to get your foot in there and just see if you can imagine yourself in that role.
Great advice. Anything else that you would ask in an interview that comes to mind?
Yeah, I think also asking what the training process looks like because that can be really important. Do they have the staff to give me proper training or is it going to kind of be a rushed process? And so just really leaning into those type of questions and what you can expect when first getting into the door. And then also asking what would make you successful in that role because I feel like that gives a basis of what their expectations are. And again, it can teach you a lot about the company, the role, and if you feel like you would be a good fit in that position.
Something else too to touch on, just because as you venture more into outpatient, you will possibly encounter a small privately owned clinic. And I think that there are definitely differences
Hmm.
in management when it's not a giant organization that owns a satellite clinic. So talk a little bit about experience from that lens.
Yeah, so my last 2 jobs were actually privately owned, and I actually really liked it. I feel like it was a nice change because they have a lot more of the family feel, and so I know a lot of the time in the hospital, you're kind of just another nurse, and this is your assignment, and that's kind of it. And so I feel like transitioning to a privately owned company, it's a lot more of like you're important. They need you there, they need you to work. They can't just float somebody in if you're sick. Your team's relying on you. And so I think it's just a nice feel because you feel needed and you feel important and they know your name, they know a little bit about you and it's kind of just yeah, more of like a family feel. And so I think that's really nice. It's a lot easier to get time off because I know in the hospital, if they needed you for staffing, the answer was no. Like there was really no way around it. You had to work. And with outpatient, as long as you ask in advance and they're able to maybe shift people around, just make it work, then you can get usually the time off that you need. And so I think that's really nice because life happens. And I think my biggest thing, which I think Kiana feels the same, but you got to have that work life balance. And so I think it's important to be able to have time off. And, you know, if your family's going on a vacation, it's important that you're there because you don't want to miss out on life things just because you can't get time off of work. So I think that's one thing that's really great about privately owned is you don't have to miss out on important life events.
Great little sentiment. Because, yes, I think it's very important to spend time doing things that you love that are not related to a job. Is there anything that you wanted to touch on before we kind of transition into talking about what you
Yeah.
do on your off time?
Yeah. I think one thing that I've always wanted to actually tell more people is that when you graduate nursing school, write yourself a 1 year letter because I think I heard this in my new grad class that we did. And I ended up writing one. I feel like it's just a fun way to look back and see how far you've come. And so I wrote it right before I started in the NICU and I read it at my 1 year. And I feel like it's just amazing to see how far you come and what kind of advice and encouragement that you gave yourself a year prior. And so definitely do that. I think that's kind of a fun thing to just celebrate your accomplishments. And
That's actually really fun.
Mhm.
Reminding myself that my younger self would be so proud of me is something that I always try to remind myself of too.
Yeah.
So now we'll transition a little bit into what you're getting into now. I think it's something fun and interesting for people to hear what you're doing with the very little free time that you do have during
Hmm.
the weeks because again now the role that you're working in you are working 5 days a week which is a little bit more taxing than working 4 days a week. Yeah, talk us through what you're doing with your free time, kind of what got you into it and kind of where you want to take it.
Yeah, so I started my YouTube channel finally after many years. I started back in August and I've been posting 2 videos every week since then. And I just think it's so fun. I think it's a really good creative outlet and hobby outside of nursing. And I love beauty, I love fashion, I love lifestyle. And I feel like this just gives me a good kind of platform to share myself and more of my interests outside of nursing because I know that nursing is my career, but that's not my whole personality. And so I think YouTube is just fun and it's carefree. And weirdly enough, I really like having a deadline. And so I really like that I have a video, I have to edit it, I need it posted by this day. And once it's scheduled, it's kind of like an accomplishment. I feel like it's a little project and yeah, I think it's fun.
Oh, that's so fun. I think it's what you just said about having a deadline and having like a structure speaks a lot to just anyone can relate to this if they went
Yeah.
through the traditional schooling system and then did some type of bachelor's program and or continued education. Like we had
Mhm.
spent so many years where this semester, this quarter of work and then we'll have to do finals and then you'll get a little break and
Yeah.
like that structure, that's comforting.
Yeah,
What's
it
not
is.
super comforting, and I think a lot of people don't necessarily talk about, especially if you are about to graduate or you just graduated or you graduated within the last 2, maybe 3 years,
Mhm.
that structure completely goes away. You're now not hitting those same milestones with those same people. You know, now it's like, I don't want to say a free for all, but it kind of feels that way. Like people are getting married at different times, people are having kids, people are moving away. And that structure is obliterated. And so
Mhm.
trying to find our own new structure or new routine or things that bring us joy, there's, I think, a learning curve with that as well. So I
Mhm.
love to hear that you have found a structure, you really, really like it. I think something else to point out that you haven't said is you've only been doing this since August. She's got a lot of subscribers. A lot of people that
It's
are
slow.
watching
It's
your
slow
videos.
growth, but
I mean, she's over 50 subscribers as of right now, more than 50. I
Mhm.
don't know exactly how many, right? But if you
63.
63 subscribers as of today's recording, everyone. What I cannot fathom, and I understand that's probably a very small amount in the terms of number of subscribers for like the top YouTubers, right? But
Mhm.
there are more than 60 people regularly watching your content. Some of your
Mhm.
videos have gotten thousands of views, right? Some of them have really kind of blown up. But if you sat every person down in the room that you're subscribed, people are subscribed to you, and you had a
Mhm.
conversation with them, that's a lot of people. And I
Mhm.
think that more and more we don't celebrate things that seem small to some, but that's a significant
Mhm.
number for someone who just started back in August. So I
Yeah.
think that that's really exciting. She loves the long form content. She's really great at it. So
Mhm.
if that's something that you also love to watch, go follow her. What is your YouTube account?
My YouTube, it's just Alli_Brianne, Brieann. You can also just look up Alli Gamble and it should pop up. But yeah, I actually really like long form content more than short form, which I was really surprised about. But I feel like it just gives you more opportunity to show your personality and kind of just say more what's on your mind, which I really like. And TikTok's a lot more short form. And so you just got to get to the point right away.
Yes. Well, again, she's really great at it. You'll see all sorts of her day to day, her life, her dog. I'm on there
Yeah.
sometimes. You ask me, and I am very supportive as a sister, and I will say absolutely yes. But I probably just make a fool out of myself majority of the time because I feel really awkward. I will stick to aesthetics, the pod, other forms. And yeah, so tell us some of your 2026 goals and the goals that you have with YouTube.
Yeah, I really want to stay consistent with the 2 times a week. I feel like right now that's manageable. Maybe I would ramp it up to 3 times, but I've seen a lot of advice on the internet and Google just basically saying, keep it fun, keep it fresh, don't overwhelm yourself. And so I think just keeping it at the 2 for now. But going into 2026, I really want to just lean into YouTube more and just really push myself in the creative sense. And so just getting more comfortable with filming, talking to the camera, editing, I think is just kind of a great starting point for 2026. I need to do a little bit more 2026 planning. I want to write down more goals and like formally kind of write it down. But I would love to have more flexibility and more opportunity with doing content creation. And so I think just again, having that balance between something that I'm passionate about and nursing, I think would be really great. And so just really leaning into that. Who knows what will happen, but I'm just going to keep working at it. I feel like now that the snowball effect kind of has been happening of I'm in the routine of posting twice a week, I think it's easy just to keep that momentum going. And so, yeah, we'll see.
I love
Mhm.
your 2026 goals, but tell us what it felt like to start out and try to build that momentum where you're comfortable in front of the camera and you're
Mhm.
editing and you're feeling really confident.
Yeah, it was definitely a trial and error, maybe a little bit clunky because I first had tried TikTok. I was posting on TikTok and I think it was when we did the Get Ready with Me. That was my first video on YouTube. And that was when I really started posting on long form content. And I think it just kind of ended up happening. I was trying to do TikTok and then leaned into YouTube. And now I think YouTube has just felt the most natural and it's felt the most fun for me. I think having that project aspect I really like. And I feel like I'm very introverted, and so YouTube just gives me the opportunity to slowly open myself up. I think it's important just to try a bunch of different things. If you're into content creation, really try Instagram, try TikTok, try YouTube, maybe a podcast, and you'll kind of see what fits and see where you gravitate towards more. Because now that I've found YouTube, I feel like it really is just a trial and error process because you don't know what you're going to like. You don't know what you're going to kind of mesh well with until you just try it.
Yes. So her advice, you guys, is try it.
Yeah.
Try it, because I think that's the hardest thing, is just trying. I think we do a really good job, and my husband as well, of calling each other out when we're like, we want to try something, but maybe we're scared. Or,
Mm-hmm.
yeah, at the end of the day, you're scared of failing or you're just scared to try. And I think if you can find somebody, whether that's within your family or, a significant other, or maybe a friend or a coach, to really push you to do something that's scary, you'll end up further than you anticipated you would. Or, you open a lot of doors that maybe you didn't realize were available to you. So I think that that's a really important sentiment of just try. Like, what's
Mm-hmm.
the harm in trying?
Yeah. That's how I felt about this podcast. I was really nervous to come on, but I was like, I just got to put myself out of my comfort zone, and who knows, maybe it'll be really therapeutic to just kind of chat. And yeah, it was nice actually, because I was preparing for the podcast last night and I was just doing a lot of reflection on my nursing journey. And I feel like it's kind of a fun aspect of podcasting is, you got to think about your topic and reflect and dig deeper. And sometimes with life being so busy, especially as a nurse, you don't take a second just to like sit and think. And so I feel like it gave me a really good opportunity just to reflect on life and my experience as a nurse.
You talked a lot about nursing. So I
Yeah.
do want to wrap the podcast back into aesthetics a little bit. I don't know, actually, if the people listening are like, well, she's a nurse, why would she not do aesthetics? Talk to us a little bit about if that's a possibility for you in the future, or maybe your hesitations for going into something like aesthetics, or just your thoughts on it.
Yeah, I have been more open to the thought of it more recently, but I don't know yet. I'm open, but I don't gravitate towards doing all of that. Maybe different components like skincare, or right now I'm just kind of enjoying YouTube and the makeup aspect of that. And so who knows, we'll see, but I'm just kind of taking it day by day.
I mean, I'm just saying for the people listening, because they're all thinking it too, is they're like, she likes beauty, she likes skincare, at least in our personal lives, and at least with my own patients, when they do find out that you're a nurse too, they're like, oh, are you guys going to work together? And I'm like, I don't know. She doesn't really have an interest in it at this point. And so I think that
Yeah.
is funny for the number of nurses that would love the opportunity to get into aesthetics. Alli Gamble is like, yeah, maybe.
Yeah, maybe. I don't know. We'll see. 6 goals and then we can recap.
Yeah. No pressure or anything. I'm just kidding. uh so anything else that you want to share about YouTubing or nursing, or anything for the listeners to get to know you a little bit better? I mean, you did talk about how you were nervous to get on the podcast. Is this something that you would be willing to explore in the future, or become a guest again?
Definitely be a guest again. Maybe I'll start my own podcast. Who knows? Definitely keep an eye out because I'm not opposed to it. I kind of liked being all chatty, but I feel like it's fun. It just
Well,
feels like you're hanging out with your best friend and just talking. And I think it's nice to give the little bit of wisdom that I have.
yeah, I think like you said, try all the things. And I think that podcasting, at least for me, it feels a little less, I don't want to say less effort, because again, I'm still editing, I'm still managing that. Maybe now similar to maybe YouTubing in terms of like the long form content, only now because I'm obviously doing more of the video. But before, it was obviously no video. You're just having a conversation back and forth and getting to know other people. And it can be really empowering to be on the other side of it and being the host and asking questions. And it's just kind of fun to get to know people virtually. And it's really cool because, maybe I would have never had that opportunity to actually have that conversation or meet them in person.
I think everybody has such a unique and special story too, and how they got to where they are. And so I think it's really interesting and fun that you're able to have those conversations.
The last question, I think I should start asking all my guests
Oh
this,
gosh.
because almost every person that I have on the podcast is obviously in healthcare in some realm of aesthetics. Obviously, you're in healthcare, not in aesthetics, maybe. But maybe in the
Yet.
future, right, yet. If you could go back to the very beginning, would you choose nursing again? And it's okay if the answer is no.
I think yes, because I've had so many nursing experiences that have gotten me to where I am today and have shaped my perspective, my mindset, and kind of just me as a person also. And so I think that if I wouldn't have done nursing, I wouldn't have had all those very important learning experiences and moments of growth as a person. And so I think I would go into nursing again. I think it gives so much flexibility of specialty, and you can be inpatient, you can be outpatient, you can do dermatology, allergy, aesthetics. Like there's so many things you can do. And so I think it's great that you're able to try a bunch of different things and you're not committing to one specific specialty. And so yeah, I think I would.
I don't know if my answer is yes or no, because here's the thing. I think that my answer would be no if I wasn't doing what I'm doing now, because I
Yeah,
actually
that's
love
true.
aesthetics and it's like such a passion for me. And
Mhm.
I've really found exactly what I'm meant to do in life and in
Mhm.
nursing.
Yeah.
But if I wasn't in this specialty, I don't know if I could speak so highly of it necessarily. And my answer is I don't know, because I don't know what I would do if I wasn't in healthcare. We talk a lot about some of the challenges from a systems perspective and an organization perspective when it comes to healthcare. And there are challenges, 100%. But for my personality, I think I could obviously do something else, but I just don't know what that would be.
Yeah, no, I think so too because I have no idea what I would do if I wasn't a nurse, but I think I really like the stability of nursing. I'm very much I like structure, I like stability, I just like to know. And so I think that's what's really great about nursing is you do have that stability. And when I moved down to Arizona, I knew I was going to find a job. And yeah, outpatient was a little bit trickier to find a job than hospital, but there are plenty of jobs and so I think that's a little bit comforting to know. It's nice to know that nurses are needed and even if a pandemic were to happen again, like you would have a job.
Yeah, I guess you're right. So I think to wrap it all up, I think both of our answers would be yes,
Kinda.
because we don't know. Like, I like science too much. I think you did share where people can find you on YouTube, but if you
Mhm.
missed it, what is your channel? Also, spell your name because most people
Oh
don't
yeah, that's
spell
true. My first
Allie
name.
the way
Yeah.
you spell Allie. I think also something else to mention is no, Allie is not short for Allison or like
Yeah,
anything
just
else.
Allie.
Your name is Allie.
Yep,
So
just Allie, that's
so
it.
yep. So spell your name, tell everyone where they can
Mhm.
find you on social media, YouTube, all of those fun things.
YouTube and Instagram, you can either search Alli Gamble, Alli Gamble, Gamble. And the username is Alli_Brianne, Brieann. And then my TikTok is just Alli_Gamble. And yeah, follow me if you guys want to see some long form content.
And if you want to see me make a fool out of myself sometimes.
We do post it. I think I have 2 get readies with me's with Kiana, and those are kind of fun. So I'm sure we'll post more in the future. And so if you want to see her on the YouTube, then go follow.
It's kind of fun to try new products on there
It
and
is, yeah.
chat. It's to chat with you. Like, I think
Hmm.
it's more fun for us to post them together, but unfortunately, you will not see me making long form content on YouTube unless it's on her channel. So, if that's something that's of interest to you all, go check her out, give her a follow and a subscribe, just because I do have a feeling that she'll take off and do really well with that.
Bing.
Yep. So, if you want to hear Allie on more episodes, let me know. You know where to find me. You know where to find the podcast. It's at aesthetic.chat with Kiki. I'm at aestheticnurse.kiki on Instagram. You can find us on the website aestheticnursekiki.com. But until next time, beauties, bye.